Need of rehab, how COVID-19 is creating some issues. I'm Adam Murphy. The story just ahead.
With stay-at-home orders across the state, more and more people are utilizing video conferencing. I'm Ayanna Crystal. We're showing you how people are staying connected.
The first breaking news on the coronavirus crisis. Atlanta's mayor says hospitals could exceed capacity by Friday as cases in Georgia soar past 2,800. I'm Karen Greer. And Sean Gables is also here anchoring from her remote location at home. Hi, Sean.
Good afternoon, Karen Greer. Good afternoon. We are practicing social distancing. And let's get to those headlines. You just mentioned the mayor threatening to shut down Atlanta's parks and the Beltline. More on that in just a moment. But first, these stark warnings come as cases in metro Atlanta begin to spike. Here's a look at the brand new numbers just released today on those cases. 2,809 cases confirmed in Georgia. Of those sick, more than 700 ended up in the hospital, and today the death toll up to 87 statewide. The majority of cases all centered around the Atlanta metro. Fulton, DeKalb, Cobb, Gwinnett counties are all in the top 5 for the highest case numbers. Now take a look at this. This is a graph that we created to show you how numbers have skyrocketed since the first case was confirmed in Georgia at the start of the month. Since we showed you this on Friday, cases have jumped by more than 800.
Now, back to that breaking news we were telling you about. Mayor Keisha Lance Bottoms delivering some sobering news in a coronavirus briefing. Here's some of the main take. Mayor Bottoms says right now hospitals still have room for new patients, but she says that could change by Friday as case numbers continue to climb. She says the city also working to get more critical medical supplies to Atlanta hospitals, including an additional 1,200 ventilators that are expected to arrive in April. She also mentioned the city's stay-at-home order, saying city's public safety personnel is enforcing it. She encourages residents to report businesses not complying.
We are evaluating those on a case-by-case basis. If you see businesses operating that should not operate right now, please notify 311 operators of that business's name and address, and we will send someone out for an inspection, and if necessary, that business will be closed.
Right now, the mayor says there's no firm date on when the city may lift that stay-at-home order. Ahead at 4:14, hear what she had to say about city parks and the Beltline and how the different restrictions from city to city are actually causing a lot of confusion. Sean?
Karen, because of the high cases in Atlanta, those numbers, President Trump has declared a major disaster in our state, ordering immediate federal assistance. This means federal dollars will be available to eligible local governments, certain private nonprofit organizations, and will include direct federal help. The president has also extended social distancing guidelines through the end of April. That boils down to this. We will not see the country reopen for business by Easter, as the president had previously hoped for.
Hi, everybody. I'm Mike Dunstan at the Live Desk. Here's what's breaking right now on the coronavirus crisis across our country. Right now, a Navy hospital ship, you see it right here, is in New York City. The USNS Comfort has 1,000 beds and 12 operating rooms, and it could be up and running by Tuesday morning. Doctors and nurses on the ship are treating non-coronavirus patients. Meantime, hospitals will be treating people with COVID-19. And right now, Central Park in New York is looking a little bit different. The Christian humanitarian organization called Samaritan's Purse is working to set up this field hospital for coronavirus patients. There are tents for a respiratory care unit with 68 beds and 10 ICU beds. Here in downtown Chicago, crews are turning the convention center into a makeshift hospital to treat coronavirus patients. The Army Corps of Engineers saying it'll have 3,000 beds. The hospital is expected to be up and running by the end of April. And Macy's is laying off a majority of its 130,000 workers this week. Sales are collapsing because of the pandemic, and the company says it has to go to what's called a minimum workforce to maintain just basic operations. People who are laid off will now receive health benefits through May. At the Live Desk, I'm Mike Dunstan. Sean, back to you.
Mike, as we had mentioned earlier, the White House's original 15-day social distancing guidelines have now been extended. It's all in an attempt to flatten the curve of coronavirus. Natalie Brand has details from the White House.
President Trump is postponing his goal of reopening the economy in 2 weeks. He now says social distancing guidelines will be extended until at least the end of April.
I said it would be a great thing if we could do it by Easter, and we know much more now than we knew 2-3 weeks ago. Easter should be the peak number, and it should start coming down, and hopefully very substantially from that point.
Medical experts on the coronavirus task force say they convinced President Trump pulling back from social distancing now could generate another spike.
We had some intensive conversations with him, and we convinced him. He listened, and we said the better part of valor would be to extend them until the end of April, when we think it would peak and start coming down.
And they warn even cities with relatively few cases could still be hit hard.
We want every place in the United States prepared for that. So it's critical that even if you don't see it, it could be circulating in your community.
The president says he now hopes to see the U.S. on its way to recovery by June 1st. But the more immediate goal now is to make sure hospitals have the critical medical equipment they need.
The president suggested supplies being sent to hospitals aren't making it to the front lines.
Where are the masks going? Are they going out the back door?
The former head of the Strategic National Stockpile tells CBS News the government's public health emergency medical supplies are limited.
The Strategic National Stockpile is that very last lifeline. It doesn't have everything and unlimited resources that people would like it to have.
President Trump is now using the Defense Production Act to order General Motors to ramp up production of ventilators. Natalie Brand, CBS News, the White House.
Thanks, Natalie. Now to some breaking news on Wall Street. The stock market starting off the week with some encouraging gains. Here's a look at today's action. The Dow Jones Industrials gaining 688 points. NASDAQ rose 271 and the S&P 500 up 85. Now, anxiety is growing as people try to avoid getting the coronavirus. That anxiety is making it worse for so many people who are now out of a job because of the crisis. CBS 46 has heard from you, and our Haley Mason is working to bring you tools to help you find work and assistance if you need it.
Over the last week, we've been talking to people who are out of work and losing business because of the devastating coronavirus pandemic.
It's just kind of a catch-22, people canceling and then me trying to be safe and not expose myself to the virus as well.
With brick and mortar businesses closing shop for now, distribution and delivery is ramping up and places are hiring. I went online to see who had the most openings. Amazon has announced it's hiring 100,000 positions, and there are plenty in Atlanta, from delivery operations managers to web sales and finance. From a search on Indeed.com, I found that ProVantage Corporate Solutions is looking for stockers at several Atlanta locations, 20 people per location at $13 per hour. In North Georgia, Staffing in Kennesaw is hiring warehouse labor on all shifts, making and packaging hand sanitizer and soap. They're paying between $11 and $15 per hour. The company has an A+ rating with the Better Business Bureau. And Dollar General is hiring several distribution and warehouse workers and sales associates across Metro Atlanta. Also, the State Department of Labor has a robust job site called EmployGeorgia.com. So I'm here on the state's job website called EmployGeorgia.com. I think it's easier to create an account, so that's what I did. And once you get past that first login page, you'll come here. I'm clicking on Search for Jobs. You can search based on a resume that you upload, or you can search without a resume, and that's what I'm going to do now, searching without a resume. This next page will then take you to a list of search criteria. For now, I'm just going to search based on posting date, jobs posted within the last 7 days. You can search more than 100,000 jobs on this site. More than 3,000 were just added yesterday. Coming up next hour, I have some tips on how to apply for unemployment with the State Department of Labor. Reporting in Atlanta, Haley Mason, CBS 46 News.
Haley, thank you. And now to a health alert for those having medical procedures who are in need of rehab. The threat of coronavirus has created some serious issues for those trying to get into physical therapy programs. CBS 46's Adam Murphy has that part of the story.
Well, I spoke with the Dawson family about their struggles post-surgery to get their loved one out of the hospital and into rehab.
All we want is the test to come back for her to be transferred. That's all. That's all.
Time is of the essence for Kay Dawson's 86-year-old mother-in-law, Jean. She recently had back surgery and is now in dire need of physical therapy.
It's very imperative that she get the physical therapy or she could have permanent paralysis. And that's what the whole back surgery was for, so that she wouldn't be bedridden.
But Jean's rehab facility required that she take a COVID-19 test before being transferred from Wellstar Kennestone Hospital in Marietta.
We got stuck in limbo. We finally demanded the test on Friday.
Dawson said at first the hospital told her mother-in-law they didn't have a coronavirus test available. Then, after questioning the staff further, they found one.
And the doctor sitting next to her in a white coat jumped up and walked to the other side of the hallway and said, "This damn COVID-19 test is holding up my bed, and I want that bed cleared." And it's horrible to know that you think they have your back and they don't. They act like they do, but they don't.
It has been nearly 72 hours since the test was administered, and still no results.
We just want to do what's best for my mother-in-law. I just want to do what's best for her. And they would do the same for theirs.
While the Dawson family waits on the test result, they realize they're taking up an extra bed at the hospital at a cost of more than $4,000 to them in just 3 days. So I contacted Wellstar Health System. They said they were not able to comment on this specific case, but they did tell us they are expanding their testing for COVID-19 in-house. In Atlanta, Adam Murphy, CBS 46 News.
It was a gorgeous day today, but major changes are on the way. We have rain and we have